will just speak for myself. It is a principle that have been introduced to over and over again, especially given the health arena.
Right.
It has become, those initials, CQI, are bandied about all the time. What captured my imagination, because at the foundation we hope very much that we foster a learning environment, that we are not in any way, shape, or form perfect or have arrived. So implicit in that is that we're always having to learn, improve. We also want to think about how do we foster quality improvement? How do you define success? How do you build on what you've done and continue to improve it?
My speech on CQI would be, it comes out of originally the manufacturing environment as a way to improve that sector, and it's moved into healthcare, education, workforce development, and a number of other arenas as we've begun to adapt the tools and philosophy to those arenas. And it's a way to improve the organization's performance, also a way to improve service to customers. The fit there is that in any environment you work in, there are always customer-supplier relationships. That's true in manufacturing, it's true in healthcare. And by the way, our Don Berwick has been one of our champions in bringing all of these methods into the healthcare environment. And we've now gone beyond that to see how we can make it applicable to nonprofits, into philanthropy, into education, into a number of other sectors.
For me, when I think about the foundation, we are here to help promote systems change that directly benefits the residents of Connecticut. And ultimately, CQI is built and reinforces systems thinking. It is really looking at not how can Pat Baker or Jen or Monette do something better, work harder, longer. It is about what's the system you're designing and how effective and efficient is it in terms of understanding that we work as interconnected as teams, and that our connections externally are also a part of that system. And I think that we all know the systems rule. 80% of your problems are about the system, not being functional, and maybe 20% about the individual. So given that philosophy of foundation, it seems to me absolutely in alignment to take on this thinking for the foundation in terms of CQI. So it certainly aligned with our fundamental theory of change. I just see incredible potential even from evaluation. Do we really do these standard evaluations? Let me hire the research team to come in and look for 5 years. Does that really help advance the work? Or is it that we do these cycles of reflection, planning, diagnosis, and acting? Would that be a more effective way to improve people's lives through these systems?
I think you're talking about like small cycles
Yes.
of improvement rather than waiting till
Right.
the end of 5 years
Absolutely.
to figure out if we're doing well.
That's right.
I think that's the idea.
Yeah. I think it has great potential for us. I think it has huge implications for our grantee and partnership relationships and how we build a relationship that allows ourselves to improve with our partners and honor that we are serving. And I think that's very important for foundations, because I'm very conscious that we have an obligation to continue to take a hard look at ourselves, to ask ourselves if we are being effective, rather than allowing our endowment to drive behaviors we want, versus really partnering and thinking about the greater good. We have to do some strategic thinking about how we infuse this in our work and how we're respectful with our partners about it.